Hello everyone, I'm recording this session for you for a quick review. So just I will go through the notes I share with you. So to be able to revise like quick revision for you because I know you are so busy. So I think I thought I should make something useful for you. So I will start from the history. We spoke a lot about it, but I will go just quickly about please, interpersonal skills, don't forget it because it makes a huge difference in the marketing. Trust me, I am pretty sure about it. Like from doctors' results and the people who has communication skills, they don't fail. So don't underestimate this area, please, and don't listen to anyone tell you I didn't do this kind of sentences and I still passed my exam. Maybe they pass, they have something special about them or a strong medical knowledge, but this communication skills make even differentiate between good doctors and not good doctors. And here in this country, they teach them clinical communication skills as separate courses. And you know that I teach this kind of courses at Queen Mary, and that's why like all the people prefer doctors from this country rather than international medical graduate, because we just ignore this area. We think we should apply the medical knowledge with this patient and that's it. No, it's all about the patient concern and being kind to them. So like, how can I help you? Let's start from the beginning. After introducing yourself, how can I help you? Whatever they're telling you, I have headache, I have chest pain, whatever, just do this clinical communication skills sentence first, not to forget and to give you good start for the stations. Acknowledge their feeling, offer support, and then continue elaborating what you have. You know, we use Socrates for pain and Odibara for anything else. I don't want to go into details because we had a session about it in details. And so whatever the patient telling you, you will elaborate in depth and don't get stuck. It's very simple. Just can you tell me more? And take it from there. You can make it just like a story, like what happened next, anything else. Let them just tell you what they have and just try to figure out what is it and go take it from there. And it will be great if you summarize back what the patient told you before you move on to your DD, like the presenting complaints. Like you can say just to summarize what you have said so far. You mentioned that you have a headache, which is started yesterday. It's mainly in the back of your head and in your neck, and you have some nausea with it, and you don't have any, you didn't vomit, and you don't have any other symptoms apart from this headache. Am I correct? Have I missed anything? And before you start your DD, ask this, because if you missed any symptoms, like the patient didn't tell you a major finding they have is still in their head and they didn't tell you. So when you said, have I missed anything? They will tell you what remaining in their script, the script they have. So you will be able to find out what's this diagnosis. So remember to ask some quick summary. And even if you are not sure about summarizing or you can't summarize, it's not a must. But before you start your DD, ask, is there anything else you want to add? So just try to let them help you to find out what could be the diagnosis before you start your DD. Because if you started your DD, you might be endless stations and the time management will be an issue. So so just try to figure out, like try to take everything from the patient head before you start volunteering your own questions. And So after they telling you, like, you have an idea what could be the DD in your head, so you can continue with just signpost, like you want to ask your DD, so tell the patient, I finish with you, I'm asking these upcoming questions just to find out what's going on with you, or to help me work out what is causing your problem. So a DD, just make them very, very few, like 3, or even like a systemic review, quick systemic review. It will help you. So you don't need to worry as much, because you already, the patient gave you everything they have. You already know what is the professional diagnosis. You have at least 2 DD in your head, and you can continue the station with it. So when we finish our DD, we need to ask idea, concern, and expectation. So also don't forget this. Ask questions is really very important for BLAB 2 and for your any exam you do in this country. So patient idea, concern, and expectation, don't forget about them. Ask them before your past medical history. And when you want to start asking your past medical history, ask signpost as well. I would like to ask you some background questions to help me learn about your past medical history, or just ask you some background questions to know if you are fit and well. Have you been diagnosed with any medical condition, any medication, any allergy, any family history, any surgery, and personal history if you wish to add. Okay, and also, as I said, please go through the questions, these sentences. Okay, so to ask about idea, was there anything you thought it might be? So this is good. You ask this question before the management. Do you have an idea what could be causing your symptoms? So they will help you with the diagnosis. At the same time, you can address their concern. And even when you tell them the diagnosis and management, the patient will be convinced that you took it from their own point of view. So like they think they have a cancer. So in the management, you will discuss that it's unlikely you have a cancer, but what you have in blah, 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 and explain to them why it couldn't be cancer. So make them convinced, make them happy that you did the right things for them. Concern, what about it is worrying you in particular? And so we know the concerns throughout the station. For example, how can I help you? I came with this headache, blah, blah, blah. So it's kind of, you know, what the patient main issue, but still you need to know if they have very specific question related to this concern, you need to address. And if they have any certain expectations that they're expecting from you, is there anything in particular that you were hoping we would do for you today? And empathy and sympathy sentences, just you can start, I can see that, or I can understand, or it sounds a bit difficult time you are going through. Just say it's a sentence that you feel it's fit with you. Like when you say it, it has to sound natural to you. So whatever you can say, just don't say any sentence just for sake of saying it, because they will not give you mark for this. But it has to be fit to you, to your personality, and you feel it when you say it. So try different type of sentences and see which one you feel comfortable when you see it, and you have good tone with it when you say it. Like if the patient, for example, have headache, and you think like headache nothing for you, and it's just a headache. Like for us as a doctors, is sometimes headache it doesn't touch us in any way. So you may not feel sympathy for this headache, but for the patient it may be distressing. So just say it seems to be very disturbing you, this headache. It sounds as if it sounds very difficult. It sounds very difficult to have been going through this headache, experiencing this headache for 3 months. it might have affected you. May I know how this affected your work and your life? So even when you ask more question with it, it will be more sympathetic, and even you show more concern to this patient. So like even when you say this kind of sentences, why not to add something more to make it like even for the examiner, they will give you more marks, because now you are not scripted or having just a stock phrase in your head. You really mean it. Like I understand how you must be feeling. This could be very distressing. Is there anything I can do for you? If it depends, for example, in what the patient's saying, but still just think about it in this way. Like you think about it is to acknowledge it and offer support and use your own sentences, but really make it too much, because this and you know that I'm talking every day about it, but why I'm saying it again and again and again, because you are not including this, and this makes me worry because from my own experience, like I know all kind of doctors join my courses so far, like the one who has strong medical knowledge, the one don't have, the one have good English, don't have, so all kind of things, but they all passed because they apply these things, and it makes difference. It makes them sound very kind, and the examiner can just change the mark even if they didn't cover something good in management or whatever. So please don't underestimate this area. Please try to speak as much as you can to show that you are kind. Doctors use this kind of sentences written here and add something to it according to what the patient is saying. So to make it fit to the patient, make it fit to what the patient is saying. So make it natural, and you are not just having stock phrases. Because even these sentences, like if all the doctors in the exam use exactly this sentence I shared with you now, still some doctor will have 4 from these sentences, and some doctor will have 0, because some of them will sound very robotic and just saying the sentence in not right place, in without stopping. Like just I can see, for example, I can see how this is difficult for you, and can you tell me more about headache? They don't stop. They don't really sound like they feel it's difficult. Just they put it just to fill the gap, and this is will not believe the examiner. But if other doctors can get very high mark with this exactly same sentences, but the way they say it, the way they include it in the stations to make it feel genuine, they are not learn it by heart just to say it. They say it because they really mean it, and they stop and they elaborate with the patients what distressing them and offer support, and just so try to be different. And this will come with practice. If you didn't include it in your practice, in your daily practice, you will not improve that fast. And this is something I really just kind request. Please make it a like practice more to include improve your communication skills, because I know you still we practicing how many sessions so far, but still like you trying you say one sentence or you don't say at all. So this is really distressing me, because I know how this important it is. Okay, so go through them, please read as much as you can. All right, so yes, so breaking bad news also, we can memorize by heart some few sentences, so make us in the exam go faster, but say them in the right place when the patient wants them, because sometimes even the bad news, it cannot be bad news for some people. Like, so telling the son his father has intracranial hemorrhage, you don't know this son's relation to his father, if this news is going to be distressing or not, and telephonic consultation is extremely difficult. So many people fail this station because there is miscommunication between the patient and doctors. So please try to, yes, we follow the steps, but try to listen to the patients, find out what their concerns, and like maybe they're concerned about just next step rather than what happened is happened, but they need to know, is this patient going to be treated in the hospital or in the hospice or at home, or maybe they're busy at work, they don't want to look after their deceased patient or the patient who's dying. So you don't know. In this country, everything is possible. So just try to find out their concern. Even in the real life, try to find out what the major concern for the patient you're talking to, rather than just volunteering information and just leading the stations as you are supposed, and they are just have to answer your questions. It doesn't work this way. So these sentences, just to help you, is a station, but you may not use them as well, because it depends on the patient if he's distressed with the news or not, or if he really care about the news you're giving them or not. And over the phone, you will not know the emotions. They may just stay silent. So you need to find out, may I know how this news left you feeling? Anything I can do for you at the moment? I'm really sorry. I had to deliver this news for you. Please let me know if there is any things I can help you with. So this kind of things. And so they can ask you questions. You don't know the answer for it. Even in All Blab 2, someone can ask you questions and you are not sure about it. So just say, I'm really sorry, I don't have the right answer for you now at the present, but I will contact my senior and get back to you as soon as possible. So please, yeah, and we break the news in layers, so we don't tell the news straight away from the initial station. And as you remember, we started with collecting the data first and taking even past medical history, short past medical history, and before you start in breaking the news. And even before you start the breaking, invite them, like ask them, do you know, do you have an idea what your father current situation, or what is going to happen next, any expectation? So try to make it exactly like any station, like his concern, expectation, before you start delivering the news into small pieces. So you can say, yes, your father has, unfortunately, the scan showed bleeding, and check for response and offer support, blah, blah, blah. And again, say it's massive bleeding, I'm really sorry, and check for response again. And then say surgery is not benefit. And in the end, say about palliative care. Okay. And yeah, also from good communication skills, don't forget about positive language. So this is very good questions. I will explain it to you now. I'm glad you asked, and let me explain the treatment for you. And or if they have a healthy lifestyle, braid them on this, or just braid them for coming to see you. Thank you so much for coming today. Thank you so much for bringing your son today. You're really caring patient, and we will do our best to help you and your son. Very simple, but it really makes a huge difference in your marks, and even in the real life, it makes huge difference in the patients respond to you. So these things make it a habit for you. Please don't ignore it. All right. So just quick revision. We have this station. We have 2 stations about sore throats. So we have even more than 2, because we have tonsillitis. We have tonsillitis, like just patients wants pediatric station. So the mother wants surgery for her son. And also we have viral, just laryngitis or pharyngitis, acute pharyngitis. viral, like common cold, and she wants antibiotic. She's big lady, but she wants antibiotic. So it's kind of just to be aware of the indications of giving antibiotics, and also about indication for doing surgery. So learn these things by heart, because there is 3 stations about them. So it's good to be aware of the basics. But you will do exactly same approach and same history. And as I said, in management, don't forget about symptomatic treatment. So always give just simple analgesia like ibuprofen and paracetamol, and antibiotics. So as I said, there is certain indications for giving antibiotics or not, using center criteria. So we will, I will show you right now about them. But so center criteria, presence of tonsillar oxidates. So in the station of tonsillitis, they give you a tonsil with this oxidate. It's very big one, and it has whitish buzz around, so it's very obvious. So this child, you can give antibiotics, but surgery, we need to see if there is indication for surgery or not. So center criteria: presence of tonsillar oxidate, presence of tender anterior cervical lymphadenopathy. So you would say, even if telephonic consultation or face-to-face and the child is not here, still you will say, I'm going to examine your child. I'm going to do general examinations and vitals, and examine their throat and their chest. When you say this, the examiner will give you findings, give you papers to read the findings. So we'll find a large lymphadenopathy, whatever, temperature, blah, blah, blah. So they will give you the findings so you can know what to do. Even if it's telephonic, there will be papers in front of you. They will tell you, doctors, take these papers and read what's there. But first, you have to verbalize them. Just don't say, I will do examination. I will examine him, and stop like this. Even if it's telephonic, don't say, I'm going to examine him. You say, going to do general examinations and examine his vitals, like checking his pulse and blood pressures and temperature, and examine his throat and his mouth and his chest. When you say all this, the examiner will give you finding. So center criteria: presence of tonsillar oxidate, presence of tender anterior cervical lymphadenopathy, history of fevers, absence of cough. So the presence of 3 or 4 of these criteria suggests infection due to streptococcus, and antibiotic is indicated in this case. So 3 of them. Let's see, we don't have examination, but we have a history of fevers. We have absence of cough from the history. Yeah, so we have 2 in the history. We have 2 in the examination. Presence of tonsillar oxidate, anterior cervical lymphadenopathy, fevers, and absence of cough. Okay, 2 examination, 2 from history. Okay. Complication, we don't need to worry, but otitis media will ask in the history about otitis media symptoms. And differential diagnosis of unilateral tonsillar enlargement. Yeah, if it is unilateral, but this is not, I don't think will come in lab 2. We don't need to worry about it. But if it is unilateral, we need to exclude malignancy. And as I said, in all lab 2, we'll ask malignancy symptoms, just any fever, night sweat. It will cost you nothing, and it will add on to your history. So it's not. Since I think the exam, they brought papers like this for the. So indication of tonsillectomy. So this will cover the other stations. So we have 2 stations: one for giving antibiotic or not, and one to do surgery or not. for indication for tonsillectomy, it has to be recurrent sore throat is due to tonsillitis. So the first thing to confirm that is every time the child has sore throat, it was tonsillitis. So it's like just you will elaborate each episode they have. So the mother will tell you, for example, he had 4 or 3 episode of tonsillitis in the past. So don't take it like this. You have to make sure this was tonsillitis. So can you tell me about each episodes and what happened? And for example, she saw the GP and the GP told her this is tonsillitis and what treatment is given at that time. So he gave her antibiotics. So yeah, so the sore throat was definitely from the tonsillitis, because he could have lots of viral infections, and the mother will add this episode to the tonsillitis one. So you need to make sure the sore throat was due to tonsillitis. And the episodes of sore throats are disabling and prevent normal functioning. And this is very important to ask in your history, like how this sore throat affected his life. Was he able to attend his school if he's in school age? And like when he has any of these episodes, how this affected him. And this is question also we'll ask in all blood station. Just ask, may I know how these symptoms affected you? May I know how these symptoms affected your child life? It will add to your communication skills marks and also importance. Okay. So more than seven or more well-documented, clinically significant, adequately treated sore throats in the preceding year. So 7 or more sore throat which is due to tonsillitis in the past year, 7 per year, 5 or more in each of the last 2 years. So it has to be like 10 in the past 2 years, 10 episodes in the past 2 years, 5 in each year, or 3 or more in the last 3 years. So we have like 9 episodes in the last 3 years, 3 in each year. So this is the indication of tonsillectomy. Okay, and so the mother in the stations, you will find that like she had less than 5 in the past year. Anyway, she doesn't fulfill the criteria to do tonsillectomy. So your task now is to convince the mother why it's not necessary. So you can speak about complications of the surgery. So it can cause hemorrhage, it can cause infections, and hemorrhage and infection is the side effects for all surgeries. So very easy to remember: hemorrhage, infection, injury to the local organs. Hemorrhage, infection, damage or injury to the local tissue. In addition to anesthesia complication, if need to be done under general anesthesia. So this complication you can remember easily, and you can remember them for all surgery stations. Like if there is need to talk about complications, we have some few stations you need to speak about complications. Simple, just infection, hemorrhage, injury, or damage to local organs, and anesthesia complications. All right. So now we cover tonsillectomy and indication for antibiotics. So the station that for this tonsillectomy was a child, and sore throat was adult, 20-something her age. So the other one, she has viral infections and she needs antibiotics. The station about this. So you know the indication for antibiotics. Like at least she need to have the kind of oxidate tonsillitis or any enlarged tender lymphadenopathy or any very high grade fever that is not responding, or the symptoms continue more than 5 days. There is other different indication for adults for giving antibiotic or not in sore throat. I think I shared the material as well in different places, but the idea is the same. Just to give high general advice about simple measures, like just hot steams and healthy fruits and diet, and have some rest. And if she's not improved, always safety netting. If your symptoms get worse or not improved, just please come back to us. And in this station, she did even a swab, so throat swab, and it was showing viral infection. So just will convince her you only have viral infection. Simple general measures, and that's it. So we spoke about center criteria. So we said 2 for examinations and 2 for examination. Here they add a fever, history of fever over 38. These are nice guidelines. And tonsillectomy, we said the sore throat has to be due to the tonsillitis, and the episode are disabling and prevent normal functioning. 7 or more in the last year, 5 or more in each episode in each of the preceding 2 years, and 3 or more episode in each of the preceding 3 years. We finish from that, and that's it. So quick notes about tonsillectomy and antibiotics centered criteria for giving antibiotics. And we spoke about including your IBS sentences in your practice. Please, I would say it again and again and again. Please, you will remember me in your exam. So please, and after your results. So please, if you can't do anything, just be kind, doctors. Include these sentences, learn them by heart, say them as much as you can. You will come back to me and tell me how this affected your results. Thank you for now. I will do another recording on my free times. Wish you best of luck.